At the IMS meeting in Rio de Janeiro, I was part of the presentation on MRD, and that was a reflection of all the work we have done for almost 15 years. I started my work in 2009 at the NIH as an interagency collaboration with the FDA and the National Heart, Lung and Blood Institute. And we formed a group from the NIH that moved forward, and we shared a lot of the results with academia and patient organizations. We continue working for all these years, and we gathered all the data sets for all the randomized clinical trials, both newly diagnosed and relapsed patients. We call this the evidence meta-analysis. And we worked with the FDA for all these years. I had filed an IND, which is the same type of application a drug company would use when they filed for a new drug to have it reviewed by the FDA. And after all these years, after all these negotiations with the FDA, in January of 2024, we were formally told that the ODAC committee, the Oncology Drug Advisory Committee that the FDA uses for drug companies when they have the data for new drugs, that committee was going to review MRD as an endpoint. And that never happened before in any other cancer. So I was the first presenter there, and I presented the evidence meta-analysis, and we show a very strong case in favor of MRD as an early endpoint for accelerated approval in multiple myeloma. So here at IMS, we talked about that. There was also the I2 team that had also worked. They started their work a few years after us, and then we worked in parallel, and we joined back in early 24, sharing our results with each other because both the groups were going to ODAC, and we wanted to make sure that was a very consistent message so the ODAC committee would not be confused. So that's also was part of the story, how you can work as two parallel teams. So you could say it's sort of, you compete a little bit with your friends, but at the end, it's all about working together and doing it for the greater good, and we work for the patients. So we helped each other in the end. There were some flaws in some of the analysis. We shared our analysis plan, and it could be corrected, and we could go together and give a very strong case. And that sort of was the bottom line of the IMS presentation here, to share all the work and how that led to 12-0 in favor of MRD at ODAC.